Good morning, everyone. Today's topic of discussion will be treatment of asthma. In this, we will talk about the medications, their route of administration, their common side effects, and at what doses these are to be given, and the special comments. So, starting with the first category of drugs, that is bronchodilators. In this, first of all, we will discuss about salbutamol. Salbutamol, it is given by various routes. For example, MDI, in this it is given 100 microgram per puff. As a respiratory solution, it is given as 5 mg per ml, and in respules it is available as 2.5 milligram per 3 ml, and in dry powder capsules also available as Rotacap, that is 200 microgram concentration per capsule. And the common side effects include tachycardia, tremors, palpitation, hypokalemia, and hyperglycemia. The dose which is to be given of salbutamol 1 to 2 puff 4 to 6 hourly, and as respiratory solution or respules it's used for nebulization 0.15 to 0.2 milligram per kg per dose, and as Rotahaler it is given 1 dry capsule 4 to 6 hourly. And the special comments are salbutamol, it is a drug of choice for acute attack of asthma and is also used for the prevention of exercise induced asthma. Second thing is terbutaline. Terbutaline, it is given 250 microgram per puff and MDI, and the dose is 1 to 2 puff 4 to 6 hourly. Third is salmeterol. Salmeterol, it is given as 25 microgram per puff MDI, or also available as dry powder capsule, that is Rota capsule, as 50 microgram per capsule. And side effects are tachycardia, tremors, hypokalemia, and hyperglycemia. Dose is 1 to 2 puffs 12 to 24 hourly, and 1 dry capsule powder inhalation 12 to 24 hourly through Rotahaler. And comments are specifically used for salmeterol, specifically used for long-term prevention of asthma and used for nocturnal symptoms and exercise-induced bronchospasm. Now, continuing further, we will talk about the formoterol. In this, it is available as MDI at concentration of 6 or 12 microgram per puff. And as Rotahaler or Rotacap, it is available as dry powder capsules in a concentration of 12 microgram per capsule. So dose which is to be given of formoterol is through MDI, it is to be given 1 to 2 puffs 12 to 24 hourly, and through Rotahaler it is to be given as 1 to 2 dry powder capsule inhalation 12 to 24 hourly. Since these both salmeterol and formoterol are long acting beta agonists, so these are to be given once a day or twice a day. Now, this formoterol is a composition of a smart therapy. Smart therapy means single maintenance and reliever therapy. These include budesonide and formoterol, and it can person can take inhaler up to 12 puffs a day. Next drug is theophylline. It is available in the concentration of 100, 150, 200 or 300 milligram tablets. The toxicity, it is occurring at the dose of more than 20 microgram per ml, and also causes nausea, headache, tachycardia and seizures. It is to be given at a dose of 5 to 15 milligram per kg per day in 2 divided doses, and theophylline is going to cause drug interactions with the antitubercular, anticonvulsants and ciprofloxacin. Next category of drugs will be mast cell stabilizers. In these we are going to study sodium chromoglycolate. Sodium chromoglycolate, it is available as 5 milligram per puff MDI dose, and it is going to cause bitter taste and cough, and doses is 1 to 2 puffs 3 to 4 times a day, and it is used as a continuous prophylaxis for the control of symptoms. Second, that is ketotifen. It is available either in tablet form, that is 1 milligram, or syrup form, that is 1 milligram per 5 ml, and causes sedation and weight gain as side effects, and it's given as a dose of 1 milligram twice a day, and it's safe medication for the oral route for oral use. Now, at last, we will discuss about the third category, that is inhaled corticosteroids. In this, first we will talk about the beclomethasone. It is available in concentration of 50, 100, 200 and 250 microgram per puff. And adverse effects will be cough, dysphonia, oral thrush, and oral thrush can be minimized with the use of spacer. And negligible side effects are seen at the dose of less than 400 to 800 microgram per day. And doses which is given of steroids will be low dose steroid, that is at a concentration of 100 to 200 microgram per day in 2 divided doses, and medium dose, that is 400 microgram in per day in 2 divided doses, and high dose will be at a concentration of equal to or more than 800 microgram per day in 2 divided doses. And comments will be about budesonide and fluticasone. These both are completely inactivated during the first pass metabolism, so they have got minimal systemic side effects. And high doses or long duration, if used, they are going to cause systemic side effects such as growth suppression, adrenal suppression and skin thinning. Now talking about the budesonide, it is available as 50, 100, 200 microgram per puff MDI. Second, that is in raspule form, it is available as 0.5 and 1 milligram per ml. Third, that is rotacap, it is available as 100, 200, 400 microgram per capsule. And next, that is we will talk about fluticasone. Fluticasone, it's available as 25, 50 and 125 microgram per puff concentration of MDI. As dry powder capsules, it's available as 50, 100 and 250 microgram per capsule. And raspules 0.5 and 1 milligram per ml.